Good morning, Las Vegas, and welcome to A Healthier Tomorrow, the #1 community health program in Las Vegas, right here Wednesdays at 11 on Power 88, the People Station. I'm your host, Will Rucker, and I am so excited for today's program. Today, I am flying solo as my amazing and fabulous co-host, Sierra, is out honoring her health as she should. So, Sierra, if you are listening, we're sending you love and all the energy for some good rest. We miss you and can't wait to have you back in the studio. Now, this is the part where you become someone's favorite person. Tell a friend, ping a coworker, or shout it out in your group chat. A Healthier Tomorrow is on the air right now. As we close out September and close out August and head into September, there's a lot on our hearts and a lot on our minds. And frankly, it's a lot we should talk about. So this weekend is Labor Day. Can't believe we're there already. And while many of us think it's just a day off or the unofficial end of summer, I want to take a moment to honor what it really means. Labor Day was created to recognize the contributions of workers, people like you and me, who make our communities function, grow, and thrive. Whether you're behind a desk, at a construction site, in a classroom, or working double shifts in a hospital or grocery store, your labor matters, your health matters, and your voice matters. Which brings me to September. September is Suicide Prevention Awareness Month, and that's something we take very seriously here on A Healthier Tomorrow. The truth is, suicide does not discriminate. It affects our teens, our veterans, our grandparents, our neighbors, our coworkers, and even people who seem like they have it all together. Too often, silence becomes a barrier to healing. So over our next few programs, we'll certainly explore mental health from multiple angles and deal with the stigma, talk about access and response, but most importantly, we're going to provide some hope, because suicide prevention is not just about stopping harm. It's about building lives worth living. So if you're listening today and you're struggling, please know you are not alone. Help is available. You can call or text 988, the Suicide Crisis Lifeline. There is no shame in reaching out. In fact, there is courage in connection. And this is reaching the news because I don't know if anybody's heard about this, but there's this little thing out there called ChatGPT. And folks talk to it like it's a person, which, I mean, I guess if you're bored, that would make sense. But pick a real person, because usually that's a little bit better. But right now we're finding out it gives kids in particular some really bad advice sometimes. So let's just be careful. I'm not saying this to steer us away. We should use the tools that are available, make our lives easier. But be aware that there are some questionable practices out there, and there are certainly some breakdowns in the system that were meant to protect people. I'm not going to spend too much time on that, but just want to call it out because it is in the headlines. So stay with us today. We've got some meaningful conversation ahead. And if you hear something that moves you, again, share it, text a friend, call a colleague. Let them know A Healthier Tomorrow is on the air. Without further ado, I'd like to welcome two incredible guests joining us from the Southern Nevada Health District. One is no stranger to the show, and the other is a new friend. So, Tamera, I'm going to ask you to kick us off with the introduction of yourself and who you brought with you.
Hi, Will. Thanks so much for having me back. My name is Tamera Travis, and I'm an epidemiologist with the Southern Nevada Health District.
Hi, my name is Katerina Pulver, but you can just call me Kat. I'm a health educator, too, with the Southern Nevada Health District within our Office of Disease Surveillance.
Well, I am so glad that you are here today. And, Kat, it's a pleasure to be with you. We had Tamera on our last show 2 weeks ago, yeah, and you said a whole bunch of stuff.
Sure did, as usual.
But there was so much I wanted to dive into, so thank you for coming back so we can really look into this data, really around substance use, which is a growing concern right here in Southern Nevada. I think there's still a lot of misinformation, a lot of questions about it. So you had a conference, and I want to start there. tell us how that went and your favorite moment?
Absolutely. So recently we had the Southern Nevada Substance Misuse and Overdose Prevention Summit, which Kat, lovely lady, leads and has done for the past several years. So can you tell us a little bit about the background of it?
Yeah, so the Southern Nevada Substance Misuse and Overdose Prevention Summit has been going on for about 6 years now. It started in 2020, which is, quite the auspicious year to start an event like that. And it started off very much online to keep everyone safe, with only about 80 people who attended that year. And now it's grown to be about 250 people who attend each year from across the country at this point.
Wow.
Mostly here from Southern Nevada, but of course from Northern Nevada as well and outside of the state. And we're just really excited to be able to bring more information, more data to the community and be able to share the wealth of knowledge that we have. It's not just us here at Southern Nevada Health District that presents, but also it's our community partners who are sharing their wealth of knowledge and data too. And it's led not only by us, where we do a lot of the coordination behind the scenes, but by our community partners. We have an entire planning committee that's about 15 people of just our community that's so passionate about this work and about getting this information out there and connecting with each other so we can close gaps in services and make sure that we're really meeting people where they're at and embracing their full humanity. This year, our theme was about harmonization. And when we were talking about this, one of the things we were thinking about was kind of doing this work is a little bit like a block party.
Oh, okay.
Where it's like there's a lot of seriousness to this work, but it's a block party can only be successful if everyone brings something unique to the table. If we're all bringing potato salad to the table, it's not going to be a very good block party. However, if one person's bringing that potato salad, but another person's bringing hot dogs, another person's bringing hamburgers, another person is bringing a bounce house, we need all of those approaches in order to be successful. So it was really just embracing all the different approaches that we all bring and our own perspectives to this work in order to make sure that we are meeting people where they're at and making sure that, in a time that, we can feel really divided, how can we come closer together? Because our strength is in our community and our heart is in our unity. So,
I love it.
It was a really wonderful year. And so we're very proud of it. And of course we had Tamera and a lot of our epidemiologists giving an incredible presentation on the data that we have been collecting throughout this year, that they have been so amazing at analyzing that data and pulling it together. So, we're just really excited. It was a wonderful event.
Well, I'm glad that it was a great turnout. And I mean, wow, I love the theme of harmonization. One of my favorite musicals is A Color Purple. And one of my favorite lines from that is, even the smallest voice can make a harmony. And that's what you're talking about, is everybody brings what they have. A bouncy house is pretty big, so I will tell you that's not what I'm bringing to the block party. But I'll bring, some paper napkins or something like that. But everything matters. So I love that is your approach, and as you bring together the community. So, Tamera, maybe we'll start with, why is this so important? How is this impacting our community?
Absolutely. Substance use is a growing concern in Southern Nevada. Opioid-involved overdose deaths increased 111.93% in Clark County residents from 2018 to 2024. Because of that, we are really prioritizing substance abuse.
Wait, let's just back up. So it increased by 111, we might as well call it 112%.
Basically, yes.
Wow.
So it's really a growing problem. And to what you were saying before about mental health, these are issues that are syndemic, which is why we have to work together in harmony to solve these issues. So it's really important. That's why it's a part of our community health improvement plan. We really want to help folks to not experience these issues.
And so how did you get the data to figure that out? I mean, it's a substantial increase, but I'm curious, is it just like the police department? Do they send you kind of what they find, or how do you get that information?
Of course. So some of that is done with the police department, but some of it is also done looking at vital records. So some of our epidemiologists, like Brandon DeLisi and Marco Mendez, who is a public health officer, I believe, at Southern Nevada Health District, they really look at that data to see what's happening, what are the trends, both by substance, by all substances, by demographics. So I'm not a part of that monitoring process, but our epidemiologists do that and do it very well.
Okay.
And then we also have a really innovative program that we love to talk about at the Southern Nevada Health District called our drug checking program. So we actually have teams that go out into community. We work with our community partners as well, and we asked people to allow us to swab their like pipes and their foils and things like that. And then we send that off to a lab where we get results back on like all the different types of substances that was present in that swab, in that sort of data point. And then people can then look up what they thought they were taking and kind of compare that to what they were actually taking to be more informed about their substance use. But it also allows us here on the ground to be able to navigate sort of what should we be warning our community about? What are our biggest concerns? Is it xylazine? Is it fentanyl? Is it medetomidine? Like, what is that looking like so that we can be more responsive and really take our data and turn it into action?
I can only imagine how skeptical folks are when you come up to them and say, hey, we just want to swab this and test it. They're like, are you undercover? Are you trying to get, but it's such an innovative and proactive approach because people have autonomy and they should know what it is they're ingesting. And so it's so dangerous to not know,
of course,
which adds to the overdose piece of it. But I really appreciate the fact that there's no judgment, no, condemnation with this. It's like we're really here to help and to get the information.
Oh, yeah. And our, this wasn't just something we suddenly came into community. Our linkage to action team and our health education team has been going out in community and building this rapport over a very long period of time, several years. So by the time we passing out Narcan, passing out fentanyl test strips, passing out xylazine test strips. So when this program came to be, there was a lot more trust that was already developed, that we could sort of capitalize and talk to people about. And they knew that we were going to be a safe person that we could talk to and disclose to and be able to, participate in this data collection process.
Got it. So we're going to get into a little bit more of the data in just a moment, but you did bring up Narcan, and I just want to do a shout out. I don't know whoever wants to take it, but like that's such an important resource.
Absolutely.
Yeah, so when it comes to naloxone, SNHD works alongside our community partners here to be able to provide free Narcan to our community where we don't want to collect any sort of personal information. Our only goal is that do you know how to use it, and if you've used it, just collecting some data points on like if the individual survived and, what signs and symptoms did they see that made them want to use that Narcan.
And can you explain what Narcan is?
Yeah, of course. I'm so sorry. I was getting ahead of myself. So Narcan, or also known as naloxone, is a opioid overdose reversal medication. And so what it does is you actually can put it into someone's nose and spray. It gets absorbed by the mucosal membranes, just like in your nose. And then it kicks off the opioids off the opioid receptors in your brain to allow breathing to normalize, which when you're having an opioid overdose, you have your breathing slows down. People they have blue fingertips or lips if they're a lighter skin toned individual, or they have gray fingertips and lips if they're a darker skinned individual. And then they also have pinpoint pupils, sweaty, clammy skin. Their breathing slows or even stops entirely. And so essentially when you administer this drug in response to opioid overdose, it allows breathing to normalize, which is our biggest fear. And especially when brain death can start to occur within 4 minutes. So we want to make sure we get that Narcan into that individual system as soon as possible. So Narcan naloxone is just a nasal spray that they put into the nose. It takes about 2 minutes to take effect. But once it does, it allows that individual to resume breathing so that they can get to an emergency room or an ER to get a further assistance.
So what I'm hearing is if you are having a block party,
bring the Narcan.
or a house party, whatever it is, heck, a church service, you should have Narcan on site.
Yeah, especially because Narcan is so safe to use. You can't overdose someone on Narcan. It only has an impact on an individual if an opioid is present. If they're overdosing on something like alcohol, or they're having their breathing stop for any other reason like a heart attack or stroke, it's not going to do any harm. It's only going to help. So it essentially makes it so that if there's an opioid present in their system, it can help get that off the system. But if it isn't an opioid overdose, it's not going to have any issue. It's not going to cause any harm to that individual.
And can people get this at the health district?
Yeah, they can get it either through us by going to our pharmacy anytime during our business hours, which is Monday through Thursday from about 7 a.m. to 5:30 p.m. However, we also work with a wide variety of community partners as well. We have a map up on our substance use dashboard that people can check out at bit.ly at /SNHD Narcan. Okay. And when they go there, there's an interactive map where you can find your nearest location to get that free Narcan for yourself or for your family.
Fantastic. Thank you for letting. I warned the guests before the show started that I do go on these tangents. So thank you for letting me.
Informative tangents.
All right. So I want to move forward to kind of what you found in this screening, the 2-item conjoint screen. So let's start there. Maybe talk about the questions and then we'll go into the interpretation.
Of course. So Kat was nice enough to allow me to present at the Southern Nevada Substance Misuse and Overdose Prevention Summit. And what I presented on was this 2-item conjoint screening. That is 2 questions. The first one is, have you in the last year had more alcohol or used drugs more than you meant to? And the second one is, have you felt that you wanted to cut down your drinking or drug usage in the past year? We use the data from the community health assessment. So if you were taking that survey, all 3,303 of you, you saw these questions. And if you answered yes to either one, or both, that is a positive result. If you answered no to both, that is a negative result. So our goal with this was to kind of see who is at risk for overdose, right? We don't want people to have to use Narcan. We're happy it exists, but ideally we don't want people to get to that point. So we're trying to see who is self-reporting using more substances than they wanted to and who wants to stop, and how can we support that?
I think that's such an important piece is we do want to save lives, but if we can stay healthy, we don't have to get to that point.
Absolutely.
So, and then what did you find? What was like the percentage of folks that wanted to decrease their substance use?
Of course. So for Clark County as a whole, we had a positive percentage of 18.62, which is kind of low, right? That's pretty good. And the majority of those people, the majority of that 18.62%, reported wanting to decrease their usage, which is fantastic. And we found a lot of other interesting findings by demographic as well.
Yeah, what do you think is contributing to, to me, that's a very positive indication.
Absolutely.
But what do you think is contributing to that? Do you see it in certain population groups, or just talk a little bit more about it?
Absolutely. So by sex, we see that men had a TICS positive percentage of 30.3 compared to only 13.6 of women. If we look at sexual orientation and gender identity, we see that LGBT individuals as a whole had a TICS positive percentage of 29.5. But if we look at trans individuals alone, that goes all the way up to 33.3%. So a lot higher percentage in that group. If we look at ability status, if we look at those who are disabled under the age of 65, their TICS positive percentage was 41.3. So very, very high in that group. Similarly, if we look at housing, those who are living in a shelter or those who are unhoused had TICS positive percentages of 47, 48%. So we see a lot.
Almost half.
Absolutely.
And that
of respondents.
And just be, so I'm clear on this too, the positive response means they want to decrease substance use.
Right. So it could be either. It could be that they just reporting overuse, or it could be that they're reporting overuse and they're reporting wanting to slow down. What I found is that in the groups with a higher TICS positive percentage, so that disabled group living in a shelter, men, had a much higher desire to decrease their usage than those with the lower TICS positive percentages.
Wow.
So they use more but want to stop more, which is encouraging because that offers an opportunity for intervention. So now the question is, what are the best ways for us to do that?
Absolutely. And that actually is my next question. Before we get there, though, kind of, and Kat, you may have something to add on this as well, but just what's the takeaway from this analysis? When I look at this and I see particularly like the transgender community is such an outlier, to me that speaks volumes from a cultural standpoint as well. But what did you two take away from it?
Of course, what I took away is that those in more unpredictable life stages or kind of harder lives, things like being transgender, living in a shelter, being disabled, these guys report a higher percentage of TICS positivity and a higher degree of wanting to stop. And most people who reported overuse also wanted to stop. So we want to intervene where we can. And I think my key takeaway from this is that every overdose is preventable.
Yes.
Yeah, I mean, you nailed it, Tamera. It's honestly, when it comes to addressing the overdose crisis in America and here in our community, it's important that we keep in mind sociocultural factors. When it comes to data like this, it really shows us that we need to be more, we need to be able to meet people where they're at and embrace their full humanity in order to really address this crisis.
Yeah, absolutely. Something that I found fascinating, particularly around the housing aspect, was those that owned their own home had a lower desire to decrease substance use.
By a lot.
Yeah. So why do you think that might be?
I think it speaks to potential stability and maybe being at a point where you're using the exact amount that you want to use. And you don't have a desire to decrease because you're already happy with that level. A limitation of the TICS, the 2-item conjoint screening, is that we can't tell how much substance any person is using within this. But it speaks to me that they are not wanting more or less than what they're having.
And that makes sense. If you have a more stable environment, then you feel more stable. And so you don't necessarily recognize or have a desire for significant lifestyle changes.
Right.
Yeah. I will say I'm a homeowner proudly, and I do have a desire for a lifestyle change. I want to be more active.
Okay. That's a great goal.
I want to take more walks. I want to take more naps. And drink more water. Those are the 3 things I want to change.
I feel that nap one.
So what can we do to help prevent overdoses?
So there's definitely a few things individuals can do in order to prevent overdose. One is we really encourage folks to go onto our website at SNHD, and you can visit that by bit.ly/SOUD prevention. And on this website, you're going to find a wealth of information that is available to the public, including a lot of this data that we're talking about today through our substance use dashboard, kind of see which zip codes are being more heavily impacted by this opioid epidemic. But as well as it allows you to access a lot of those programs that I've been talking about. One is we have a program at SNHD called the Strip Club.
Okay.
I know. But it's sort of a play on words because we're Vegas. But through the Strip Club, individuals can order fentanyl test strips or xylazine test strips directly to their home in discreet packaging from SNHD at no cost to them. They just go onto that website that I mentioned, they fill out the form, and we mail it to them within a week of their request. And fentanyl test strips and xylazine test strips are a really easy to use harm reduction tool that allows people to test their substances for adulterants of fentanyl and xylazine before they use it. So that way, again, they can make those informed decisions, because a lot of times here in our community, individuals think they're buying one type of substance, so they think they're getting methamphetamine, or they think they're getting cocaine or MDMA or ecstasy. And in reality, that is either laced with fentanyl or is fully fentanyl. And individuals don't know that, so they take a dosage that is very, very high, maybe what they're used to taking, and then they have an opioid overdose. So this allows them to actually test it and see if it's present before they take that substance.
And we hear a lot about fentanyl in the news, but xylazine, we don't hear as much. What is that?
So xylazine is a relatively new adulterant that we've been seeing in the drug supply. SNHD, through our drug checking program, announced that we saw it for the first time back in, I believe it was March 2024. Though we have a press release, you can go see the exact month. It's either May or March, but we saw it last year. And xylazine started on the East Coast, made its way to the West Coast, which is how most of the drug trends tend to happen in our country. And when they got to here, it essentially, let me back up. You might have heard this in the media as called the zombie drug, or it's also called tranq on the street. And xylazine is a very potent animal tranquilizer that has been added alongside fentanyl to try and sort of make the high of fentanyl last longer. And so what that causes, though, is xylazine causes people to become unconscious for long periods of time where they can't move. So people, especially people who are unhoused in our extreme heat, can end up with very severe burns because they can't roll over if they're burning from the concrete or anything. They're just they're unconscious. Yeah. So it also causes very severe wounds or people's where their skin and their flesh become necrotic and sort of fall off. So it's a pretty terrible adulterant that we've been seeing. We haven't So as a result of us seeing xylazine in our drug supply, we went ahead and launched the xylazine test strip program. And so then people can also now tell if xylazine is in their drug before they use it, so that way they can make choices if they decide not to use it, or just be more informed about that substance use, so that way they're not falling asleep on concrete or something like that, maybe a soft bed or the grass or something like that won't result in as much injury if they were unconscious.
Still, right?
Yeah.
I'm hearing this, and I'm thinking a couple of things. One is there is still certainly stigma around drug use, right? We recognize that, and thankfully, in Las Vegas with our strip club, we have a lot of pastors in particular that really want to make a difference and help. And there are so many amazing community organizations that also care, while they may not be specifically in this field.
Yeah.
We all come in contact with folks that we want to reach out to or help or make it available to our communities. So if, I'm going to order for my house, but how do we order it for my organization?
Yeah, so to order for your organization, all you need to do is email od@snhd.org. When you email that, you're going to get immediately a reply back. It's an automated response that says, hey, thank you for your interest, for becoming a distributor of naloxone, or for just having it with your organization. Go ahead and fill out an application. This application is very easy to fill out. It essentially just says, like, hey, I promise I'm not going to charge people for the naloxone I'm receiving for free from the health district. I promise to be trained and get my staff trained. Very, very simple stuff. Once that is completed, we go ahead and schedule a training where you can either take it virtually, or you can have myself or one of my fellow educators come out, and we train your staff on how to use this tool, and then we provide you with free naloxone. Our only ask is that if you are keeping it on your staff, especially, that you return it within 6 months of its expiration date. So if it's, usually the ones you receive are about 2 years until the expiration date. But just keeping an eye on it to return it to us when they're 6 months out, and we'll exchange it for free. We just want to make sure that any student expiring naloxone we can take back out and give it to people we know are going to use it within the next 2 weeks. And so that allows us to be really good stewards of the funding we get and make sure that every naloxone that comes through our door gets used.
Fantastic. So, one more question for you, and then time has gone by so quickly. I'm like, how did we get to the end of the half hour here? But for folks that do want to have deeper engagement, maybe get involved with your coalition, how do they do that?
Yeah, so we encourage folks to join us. We have a Southern Nevada Opioid Advisory Council that meets quarterly, where you're able to network as well as learn about what programs are happening, funding opportunities that are available, legislation that is, being proposed during our biannual legislative process. And if you're interested in just sort of knowing more and being a part of that and staying informed at that coalition level, you just go to snoac.org, which is SNOAC.org. It is completely free to join. And then you're also the first to learn at the next time that our summit comes to town in 2026.
Awesome. Well, Kat and Tamera, thank you both so much. First of all, for the people that you are. Secondly, for the work that you're doing. And lastly, for being on the show this morning.
Thank you for having us.
And the takeaway for me is every overdose is preventable. So thank you for sharing that with our audience. This has been A Healthier Tomorrow. I am Will Rucker. And as I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. Tune in next time.
Download the